Hi, my name is Grace Inslee. I'm going to be your SPTA today, and then looking over your case here. But first, also I'm affiliated with the Owens Community College, and is it alright if I work with you today? And treatment today is going to require physical contact to both your waist and then your legs. Is that alright with you? Okay, and then looking over your chart here, it says you're a retired construction foreman and then also martial arts teacher / boxing trainer, and that you have Parkinson's disease. And then your current situation is you've had some increase in symptoms, like you've had more difficulty walking, you've noticed more fog, which is freezing while you're walking, and then you have more uncontrolled or unsteady balance, you have decreased endurance, more increased difficulty getting out of bed to dress on your own. And then so today we're going to be working on a couple of those things that you're complaining of. We're going to be working on your balance, then mobility, and then transferring. Okay, so the complaints that we're working on today is balance, mobility, and transfers. And one reason possibly that you're having difficulty balancing is because you're not able to get a good step like this. Like you're gonna end up more like this. So it's gonna be narrowing your stance. And then also whenever these muscles start to get weaker, which also happens with age, the muscles in your core are what help stay upright, and then in your back, and then having like this is just going to make you lean forward more, which could cause you to fall. But it's important to work on your balance just so you can maintain as much independence as you can while walking. And then one of the other impairments we're going to be working on today is transfers, how you've been having some episodes of freezing whenever you're getting up from your desk chair or getting up in bed. And this can be due to the fact that with Parkinson's, you have less dopamine release, and that controls like initiating movement on your own. And that can be difficult to do then if you're not having what you need. But it's important to work on transfer still to again help maintain independence as long as you can with this disease. And then the third thing we're going to be working on is mobility. And mobility, you're going to have less mobility because you're not, like at least in your legs, you're not able to pick them up as high like when you're walking and running because of that dopamine release in your brain. And then also you're going to be less mobile because you have this type of posture, so you're not going to be able to get into this motion as much. And it's important to work towards fixing this because having a poor posture like this, being less mobile, moving back into the right spot, that can cause more balance issues, and then also can prevent you from getting a good step in like that. And that's what we'll be working on today. Do you have any questions for me? Okay, sounds good. Okay, so today we're going to be working on your sitting balance while moving. It says in your chart that you have pretty good sitting balance, like just holding your arms up to the side, but we're going to get some more movement in there to maintain the sitting balance you have now as you progress and with your disease. And then 2, this is also just going to improve those skills more to help strengthen your muscles that are helping you to have pretty good moving balance. So the muscles this is kind of targeting are these trying to keep yourself upright and have a good posture. So 3 points you want to make sure you have is you want to make sure your feet are planted on the floor to keep you safe. You want to make sure you keep your back nice and tall, pitching your shoulder blades, and then having your chin tucked. So for this, we're going to be taking this clip. We're going to be doing some big movements, picking up as high as you can, and dropping it onto the bed next to you, and then reaching for it, bring it to the middle, grab it, and then to the other side. You're gonna make sure you're keeping that posture up like this the whole time. And you don't wanna just slowly grab it like this and then like this. We want some big movements to challenge these muscles to stay where they're at. And then also to help get some more movement too while doing some balance activities. You're gonna keep doing it like this. And one reason why you would stop this intervention is if you feel any difficulty breathing, shortness of breath, any chest pain at all. If you feel yourself sweating a lot, stop this treatment and then let either your caretaker, your wife, or me know, and then we can make adjustments and change this intervention if it's causing those issues. And that's it. Okay, next we're going to be working on mobility. It says in your chart that you have some bend like this in your spine, like you're hunched over more. So we're going to be working on getting more mobility in your back. And so we're already in the position you need to start in, which is on your stomach. And then you can start like this to just try and help it like that naturally. And one thing, and we're going to be going up and pushing up onto our hands like this. And you want to make sure you're holding your shoulders back, looking up towards the sky and having your arms straight. And then slowly lower yourself down. Okay, so just to break this down a little bit, have your arms like this to start off with. And then look up, pushing yourself up to the ceiling. But you can start with this for a bit, just because I know you are hunched over quite a bit, just to help ease into it. And then you can just keep on straightening yourself out, just to break it down a little bit. And one reason to stop this exercise is if one is causing you pain. You should feel some tightness because your back is stuck in that position that we're trying to get it out of. But if you feel any pain other than a stretching feeling, then you should stop treatment and then let me know or let your PT know. And then also, the reason why we were doing this specifically is to help straighten out your back, since you do have this kind of posture, and to help do that with not with an easier way than just going like this, because then that also will take balance too. And that's it. Okay, so next I'm going to be showing you how to work on your standing, going from sitting to standing with transferring. And it says in your chart you've been having fog is what they call it. It's where you're like freezing whenever you're about to stand up, because it's just hard initiating that movement. And so we're going to be working on that. And then I'm going to be showing you how your wife can help assist you whenever you're practicing this, because for safety reasons, we want her to be close by to be able to catch you if you start to feel like you're going to fall from freezing. And so we're going to be breaking this down a little bit. So I put this bone here on the floor for something for you to look at as you're standing up. And for your wife, she's going to be helping you count down. So we're going to start first by doing a rocking motion, like you're going to get the momentum to go up. So rocking back and forth, like 1, 2, and then 3. Okay, you can go ahead and relax. And while you're doing this, you want to make sure your feet are planted on the floor, you're keeping an upright posture, and you're looking straight ahead. You are going to end up looking at the floor, but make sure that chin's tucked. And then you're going to use your arms next to you, placing them on the bed because they're going to help you push up and get that momentum. Okay? So we're going to do that again, that rocking motion, before we even try to stand up, just to get that down. Okay? 1, 2, 3. Okay? And then now that we've done that task, we're gonna then do that again, and then you're gonna push up and stand up. Okay? Okay, 1, 2, 3. Yep, just like that. You didn't freeze. Okay? And then we're gonna go ahead and sit back down because we're gonna do that 2 more times. Make sure you can reach out behind. Scoot back so your knees are touching the bed. Okay, and then we can do that rocking motion again. 1, 2, just with your hips. So just like this, like hinging. Okay, 1, 2.
I'm confused.
Yep, just like that. 2, 3, and then lean. Yeah, just like that. Okay? Since we did the rocking motions 3 times, we're gonna do 2 more standing up. Yep, we're almost done for the day, don't worry. Making sure keeping that feet planted, standing upright, using your arms as support. Okay, and then doing the rocking. 1, 2, 3. Okay, now that we're standing, we're gonna do the rocking motions to help get the momentum to sit back down. And then your wife is going to be standing next to you the whole time if you lean forward and feel like you're losing your balance. Okay, 1, 2, 3, then reaching out behind you. Yep, just like that. Okay, we're going to do this one more time, okay? You got this. And then here's this bone here. You can try looking at that too. Having a target on the floor is always going to help with preventing you from freezing before you stand up. Okay, so looking at that, 1, 2, 3. Yep, just like that. And then we're going to get ready to sit back down. Do the rocking one more time. 1, 2, 3. Yep, reach behind, just like that. Okay? And if you feel like you're getting dizzy, lightheaded, difficulty breathing, any shortness of breath at all, make sure to stop this intervention, and then we'll figure out something else we can do to work on that. Because sometimes changing your positioning too fast can cause some dizziness and lightheadedness, and we want to know if we have anything to be aware of. And then that's it. I just wanted to thank you guys for giving me your time today to show you these interventions that you can do at home. And if you have any questions at all, you can call our clinic and then you can get connected to your PT or me, one of your PTAs, whoever is working with you. And that's it. Thank you.